Imagine waking up one day and finding that your body doesn't quite respond like it used to. Suddenly, you're struggling with tasks that were once effortless. Movement, balance, and even your emotions feel different, like they're not entirely under your control anymore. This is the reality that people with multiple sclerosis, MS, face every day. MS is a disease of the central nervous system that throws the body's own immune system into attack mode, targeting and damaging the myelin sheath, the protective covering around nerves. This disruption in the myelin sheath slows down the communication between the brain and the rest of the body, causing a range of symptoms that can vary from fatigue and movement issues to vision and cognitive changes. In this video, we'll cover the various treatment options for managing MS, from injections to infusions and oral medications. We'll dive into what each treatment type does, how they work, and the pros and cons, so you can better understand this complex disease and the tools available to fight it. Section 1. Understanding multiple sclerosis, MS. Let's start with the basics. MS is one of the most common diseases affecting the central nervous system, CNS, which includes the brain and spinal cord. Over 2.8 million people worldwide live with MS. It's a progressive disease, meaning it tends to worsen over time. Here's what happens in the body when someone has MS. The immune system mistakenly attacks the myelin sheath, a protective layer that insulates nerves. Without myelin, nerves don't transmit signals as effectively, causing disruptions in how the brain communicates with the body. This disruption leads to symptoms like muscle weakness, balance issues, cognitive changes, and fatigue. Think of it as a frayed electrical wire. The insulation is gone, so the signals are spotty and unreliable. Each person with MS experiences different symptoms, depending on where their nerves are affected. Some common symptoms are movement and coordination issues, fatigue, visual disturbances, numbness and tingling, bladder and bowel issues. Section 2. Goals of MS treatment. There's currently no cure for MS, but treatment focuses on 3 primary goals. 1. Controlling and limiting new inflammation in the CNS. This helps slow down the damage to nerves. 2. Slowing the progression of disability. Over time, MS can lead to increased disability, but treatments can help reduce this risk. 3. Reducing the frequency and severity of relapses. Many people with MS experience flare-ups of symptoms. Treatments can help make these relapses less frequent and less intense. Section 3. Types of MS treatments. Let's break down the 3 types of MS treatments: injections, infusions, and oral medications. Each has its own advantages, disadvantages, and uses. Injections. An injection involves administering medication with a needle and syringe. These injections are commonly self-administered, which means a person can give themselves the shot at home. Injections are typically subcutaneous, meaning they go just below the skin. Commonly, people take injections weekly. This method is used for relapsing and long-term MS management. Examples of injectable medications for MS include interferons and glatiramer acetate, which help regulate the immune system to reduce inflammation. Infusions. An infusion involves receiving medication through an IV line. This treatment can't be done at home. It requires a visit to a healthcare facility. During an infusion, a healthcare professional administers the medication directly into a vein. The process can take a few hours, as the medication is slowly delivered over time. Infusions might be administered monthly or even less frequently, making them a good choice for people who prefer less frequent treatment. Examples of infusion medications for MS include natalizumab and ocrelizumab, which are powerful drugs that can help manage the symptoms and progression of the disease. While infusions may take longer to administer, they're effective at slowing the disease's progression. Oral medications. Oral medications are taken by mouth and may be a more convenient option for some people. These medications are designed to suppress the immune system and manage inflammation in the CNS. However, while taking a pill is easy and can be done at home, it's essential to weigh the pros and cons with your doctor, as oral medications may have potential long-term side effects. Examples of oral medications for MS include fingolimod, dimethyl fumarate, and suponimod. Research is still ongoing to understand the full long-term impact of these medications. Section 4. Comparing injections, infusions, and oral medications. Each type of treatment has unique benefits and challenges. Here's a quick comparison. Injections offer a more frequent but manageable way to keep symptoms at bay and are easy to use at home. Infusions require fewer appointments but mean a longer visit each time. They are typically more powerful, designed for those with more aggressive or advanced forms of MS. Oral medications offer convenience but may come with higher risks of long-term side effects. For some, this is a worthwhile trade-off, but others may prefer to avoid it. When deciding on a treatment plan, the doctor will consider several factors, including effectiveness, safety, tolerability, cost, and convenience. Section 5. Choosing the right treatment plan. Deciding on the best MS treatment is a deeply personal decision and will depend on several factors. 1. Effectiveness. How well does the medication control symptoms and slow disease progression? 2. Safety and tolerability. What side effects are associated with the treatment? Can you tolerate them? 3. Cost effectiveness. How much will it cost, and is it covered by insurance? 4. Convenience. How often will you need to take the medication? Do you prefer a pill, shot, or infusion? Each option has its trade-offs. Some people find injections convenient because they can do them at home. Others prefer the long-lasting effects of infusions, even if it means a visit to the clinic. Oral medications might be ideal for those who don't want to worry about needles but are comfortable with the potential long-term risks. Section 6. Managing your MS treatment journey. No matter which treatment you choose, remember that MS is a condition you can manage. Here are a few tips to help you on your journey. Stay informed. MS treatments are constantly evolving. New medications and methods are being developed, so keep an open dialogue with your doctor about the latest options. Listen to your body. MS can be unpredictable, so be mindful of how you feel, and share any changes with your healthcare team. Build a support network, whether it's family, friends, or a support group. Having people around who understand your journey can make a world of difference. Conclusion. Living with MS can feel overwhelming, but remember, you have options. Injections, infusions, and oral medications all offer different ways to help manage your symptoms, slow disease progression, and maintain your quality of life. By working closely with your healthcare team, you can develop a treatment plan that fits your unique needs and helps you continue to do the things you love. Thanks for watching, and don't forget to subscribe to our channel for more helpful health tips and insights.